Okay, well, thank you very much, Olga, for the invitation. And the idea is to show our experience in 14 years of follow-up when in surgical fetal stem cell transplantation in heart failure patients. This is the only experience done worldwide with this type of cells. We took 10 patients with idiopathic myocardiopathy in terminal heart failure, where this patient doesn't have any chance of heart transplant of anything. And we transplant fetal cells. We already published that in peer review at the first publication at 41 months. And then these fetal that we used were fetal liver tissue obtained by repeat aspiration with syringe through a range of needles. Then we freeze that and we decrease, and basically the phenotype of the cell were CD34 and CD133, CD45. We did, of the 10 patients, we did 9 patients through sternotomy, and then 1 patient from mini thoracotomy. In the patient that we did sternotomy, you see there, we did around between 60 to 80 million stem cells. Basically, this is a photograph of the patient. We did the patient because that was done for the first time in the world, so we didn't know any reaction about what happened. This patient are patients that were almost dying. We mark and we inject with a special apparatus to all the surface of the heart. The results of the initial publication basically was that all 10 patients survived the operation. At 40 months, the mean class, the New York Heart Association class decreased from 3.4 to 1.33, and the mean ejection fraction increased 31% for 26.6 to 34.8. The mean ETT increased almost 300%, as you see here, and the mean left ventricular end diastolic decreased 15% in all of the performance of the patient, and in the 6-minute test, increased 43% and more than 360 seconds. All it does is public. The mean distance increased 44%, and as you see here, the Minnesota test decreased almost 71%. The survival rate for this initial experience was 66% at 40 months. At 14 years of follow-up, 6 patients survived after 40 months, and 5 of them has complete reverse remodeling after 3 months after the transplantation of the fetal stem cells. The average age at the moment of the transplantation was 62 years old, as you see. And basically, you will see here, this is very important. This is in heart failure. You see the paradoxical septum here, and this is unique. You will see now on 7 days how the septum is stopped, not moving, because the cell start acting. And you will see now something that is unique. And 3 months, you have a new heart. This is a total new heart with fetal stem cells. As you know, this is the only example in the world that show that in any kind of such. So the results are that the first patient died at 5.4 years for an infection. The second patient died at 7.4 years for heart failure. The third patient died at 8.4 years for heart failure. The fourth patient died at 10 years for heart failure. And the fifth patient died at 14 plus 4 months years after transplant at the age of 83 years old. So the average age at the moment of death was 70 years, and the survival rate at 4 years of the group that produced reverse remodeling was 100%. and at 14 years, 25%. The most important observation in this group is none of the patients have cancer nor rejection at 40 years of implantation. So we open a new avenue here. The conclusion is that this initial worldwide experience with the surgical direct transplant of liver fetal stem cell in patients with end-stage heart failure show clearly the positive effect in the reverse remodeling of the left ventricle of 50% of the cohort. Congestive heart failure stands as one of the leading causes of morbidity and mortality in the 21st century. Traditional approaches to cardiac regeneration have largely centered on adult stem cell therapies, which have been shown to be safe, but have yielded both encouraged and weak clinical outcome over time. Despite substantial investment, these strategies have frequently fallen short, leaving many patients with heart failure relying on transplant as their only option for recovery. While there remains critical need for further investigation into the molecular and structural mechanisms underpinning these regenerative outcomes, the clinical data from both studies is robust and compelling. These words are not only for me, it's also for Professor Carlo Ventura from the University of Bologna. The observed improvement in the patient outcome make a strong case for the efficacy of fetal cell therapies and warrant serious consideration in the context of the urgent need for effective treatment for heart disease. Fetal cells obtained from 5 to 12 weeks of gestation confer a unique advantage. They lack the HLA histocompatibility system complex, minimizing the risk of antigenic between donors and recipients. These physiological characteristics significantly reduce the likelihood of rejection and distinguish fetal cell therapy from conventional adult stem cell therapy, reinforce its viability as a treatment option for heart failure. As adult stem cell therapy have struggled to translate preclinical success into viable human treatment, the therapeutic potential exhibited of the fetal stem cell in the cohort should not be overlooked. The tangible benefits I slightly indicate that effective clinical application can emerge from innovative approach to cardiac regeneration. Future investigations should focus on elucidating the mechanism of action of fetal cells to gain a comprehensive understanding of how they facilitate regeneration. Such research will pave the way to broader application and more refined therapeutic strategies. By redirecting research effort toward approach with demonstrated efficacy, we can optimize funding usage while addressing the urgent need for effective treatment for heart disease. One of the foremost global health concerns, emphasizing the success of fetal therapies, could significantly expand the horizon of cardiac care, providing renewed hope and improving quality of life for individuals battling heart failure. Transitioning from theoretical models to evidence-based practice grounded in validating clinical results is essential. Such a transition will facilitate the swift movement of medical breakthrough from laboratory setting to patient care. Recommendation for future direction. First, expand clinical trials to validate and replicate the promising findings associated with fetal cell therapy. Second, conduct in-depth investigation into the molecular mechanisms underlying the regenerative property of fetal cells following clinical validation. Third, develop comprehensive ethical guidelines for sourcing and using fetal cells, ensuring adherence to bioethical standards and donor consent protocols. 4, promote international collaboration among researchers to share insights and expedite the implementation of successful regenerative models across diverse healthcare systems. By adopting this reoriented approach, we could profoundly transform our response to one of the modern medicine's most pressing challenges, ultimately improving outcome for heart failure. For conclusion, we are the place where we are more advanced now is in Japan, that we are very advanced in trying to treat patients. we can approach this patient. We need to remember that 10% of the patients of 80-year-old in the world have heart failure. And we have one of the lines to do the fetal cells IV, as we know exactly that it's the only proof that the cells really create a new heart. With all of the investigation, that the money that was spending worldwide, we need to be very focused on what we will do in the next year. So thank you very much.